Treatment for chlamydia infection, doxycycline versus azithromycin. Definition: What is a chlamydia infection? Chlamydia is a common sexually transmitted infection caused by bacteria. People who have chlamydia often don't have outward symptoms in the early stage that make you think you shouldn't worry. However, chlamydia can cause handling problems later, including preventing women from getting pregnant or even endangering their pregnancy.
Chlamydia is a sexually transmitted infection caused by the bacterium Chlamydia trachomatis. It is the most common bacterial STI, mainly affects young people 15 to 24 years of age, and is more common among women. Between 1997 and 2011, the number of infected people nearly tripled. The people most at risk of chlamydia are those who have multiple sex partners, those who practice unsafe sex, and those who have a history of other STIs. In men, symptoms can include a discharge from the penis, pain while urinating, along with tender or swollen testicles. The symptoms resemble those of gonorrhea. They can appear intermittently or disappear completely while the person remains infected. In women, symptoms include an abnormal vaginal discharge, bleeding between menstrual periods, or after sexual intercourse. In both men and women, chlamydia can cause rectal itching or bleeding, as well as anal discharge and diarrhea. However, chlamydial infections are asymptomatic most of the time. To diagnose chlamydia, a test is required. For women, screening involves a cervical exam with a swab sample. A urine test can also suffice. For men, a urine test is now equally effective and less painful than the traditional urethral swab. Chlamydia is easily treated with antibiotics. You need to take the full course of medication and refrain from sexual relations, oral sex included, until the treatment is complete. After symptoms disappear, the infection can linger in the body and still be contagious. To break the chain of infection and to avoid being reinfected, you need to alert all your sexual partners within the previous 60 days and encourage them to get screened and treated if necessary. Your doctor can assist you in using our anonymous partner notification service. Some effective ways to prevent chlamydia are practicing safe sex by always using a condom, avoiding sexual relations under the influence of drugs or alcohol, and limiting your numbers of sexual partners. You also need to get screened regularly for STIs. Your sexual health is important to us and to you, so have fun, but be safe.
Application in medicine. Chlamydia is treated with antibiotics. The recommended antibiotic treatment is doxycycline, 2 daily dose for 7 days, or azithromycin in a single dose. Other alternative medications may be used, but they are not as effective as azithromycin and doxycycline. People on treatment for chlamydia shouldn't have sex for 7 days after single dose therapy, azithromycin, or only 7 days of antibiotic doxycycline have been complete. Patients can be infected again if their sexuality partners do not receive treatment.
Hi, this is RN Answers back with another session, and this is 5 Cures for Chlamydia You Should Know. So what is chlamydia? Chlamydia is a sexually transmitted infection caused by the bacteria Chlamydia trachomatis. Each year, millions of people around the world contract this ubiquitous STD. Chlamydia is the most common STD in the United States. The Centers for Disease Control estimates that around 2.8 million people are infected annually in the United States. Chlamydia is transmitted through oral, anal, and vaginal sex. Chlamydia can also be transmitted from mother to newborn during birth. Chlamydia symptoms in men. Chlamydia is known as a silent STD. Often there are no outward signs and symptoms associated with a sexually transmitted infection. Men in particular are likely to have no overt symptoms of chlamydia. If there are signs and symptoms present, the most common in men are burning sensation with urination, a tender scrotum, and discharge from the urethra. In the picture to the left, you can see discharge coming out of a male urethra, in case you're wondering what that picture is. Chlamydia symptoms in women. For women, missing the symptoms and signs of chlamydia can have a serious, lasting impression on their fertility. Infertility and pelvic inflammatory disease can result from untreated chlamydia. Common symptoms of chlamydia in women include painful urination, discomfort during sexual intercourse, and unusual vaginal discharge. In both genders, untreated chlamydia may spread to nearby organs of the pelvic region. So who's at risk? Anyone who's sexually active is at risk for getting chlamydia, but there are certain groups of people who are more likely to contract the STD. Teens and young adults, people with multiple sexual partners, and illicit drug users. Cures for chlamydia. Since chlamydia is caused by a bacteria, the sole treatments involve antibiotics. There are a multitude of antibiotics that can cure chlamydia. Luckily, most are affordable and readily available. However, they cannot be obtained over the counter. They require a visit from the doctor for a physical exam and a proper diagnosis. Azithromycin. Taken over 7 days, azithromycin is a standard treatment for infants that get chlamydia infections of the eyes during childbirth. Chlamydial eye infections in newborns can lead to blindness, and nausea and vomiting are notable side effects of this medication. Doxycycline. Doxycycline must be taken over a 7-day period, but it works very effectively in killing the Chlamydia trachomatis bacteria. Doxycycline is an old drug with a well-known history of working. It is not to be given to pregnant or nursing women.
Pros and cons. Pros. The surest way for a sexuality activity person to avoid contracting chlamydia is to use a condom during sexual intercourse unless you are absolutely certain your partner isn't carrying the infection. Cons. Some women develop P PID, an infection that can damage the uterus, cervix, and ovaries. PID is a painful disease that often requires hospital treatment. Men can also experience complications when chlamydia is left untreated. The epidermis, the tube that holds the testicles in place, may become inflamed, causing pain. This is known as epidermitis.
Multi-facts presence. True facts about chlamydia infection probably you never heard before. Chlamydia is an infection spread through sexual contact. This infection infects the urethra in men. In women, it infects the urethra and the cervix and can spread to the reproductive organs. Chlamydia does not cause problems if you treat it right away. But left untreated, it can lead to serious problems, especially for women. Chlamydia is one of the most common sexually transmitted infections worldwide, affecting about 4.2% of women and 2.7% of men. In 2015, about 61 million new cases occurred globally. In the United States, about 1.6 million cases were reported in 2016. Infections are most common among those between the ages of 15 and 25 and are more common in women than men. In 2015, infections resulted in about 200 deaths. causes of chlamydia infection. A certain kind of bacteria known as Chlamydia trachomatis causes chlamydia. It can spread from one partner to another through vaginal, anal or oral sex. A pregnant woman can pass the infection to her newborn during delivery. Signs and symptoms of chlamydia infection. Early-stage chlamydia infections often cause few or no signs and symptoms. When signs or symptoms occur, they usually start 1 to 2 weeks after exposure to chlamydia. Even when signs and symptoms occur, they are often mild and passing, making them easy to overlook. Signs and symptoms of chlamydia infection may include painful urination, lower abdominal pain, vaginal discharge in women, discharge from the penis in men, painful sexual intercourse in women, bleeding between periods, and after sex in women, and testicular pain in men. Chlamydia trachomatis can also infect the rectum. While these infections often cause no signs or symptoms, you may experience rectal pain, discharge or bleeding. It's also possible to acquire chlamydial eye infections through contact with infected secretions. Chlamydia may also cause reactive arthritis, conjunctivitis and urethral inflammation, especially in young men. Risk factors related to chlamydia. Factors that increase your risk of chlamydia trachomatis may include being sexually active before age of 25, multiple sex partners within the past year, not using a condom consistently, history of prior sexually transmitted infection. Diagnosis of chlamydia infection. Your doctor will ask you questions about your past health and your sexual history, such as how many partners you have. You may also have a physical exam to look for signs of infection. Several types of tests can be used to diagnose chlamydia. Most use a sample of urine or a swab from the cervix, vagina or urethra. Since chlamydia can cause serious problems but may not cause symptoms, it's a good idea to get tested once a year if you are sexually active and in your mid-20s or younger. Treatment for chlamydia infection. Chlamydia infection can be effectively cured with antibiotics such as azithromycin, doxycycline, erythromycin, levofloxacin, or ofloxacin. During pregnancy, erythromycin or amoxicillin are typically recommended. Following treatment, people should be tested again after 3 months to check for reinfection. If you have any facts of your own about chlamydia infection, leave a comment below. Please subscribe to this channel for more interesting videos. Find out more videos about health and fitness on this channel.
Insult applied in Ecuador. The first study was published in 1955 and recorded rates of up to 55% among FSWS in 1986, using the FA in samples of more than 300 individuals. The researchers found that the prevalence of CT infection was 53.4% among FSWS and 34.5% among couples, but only 1.6% among pregnant women. Therefore, more up-to-date information on the prevalence of CT infection in Ecuador and other Latin American countries will provide a better understanding of the existing burden of chlamydia disease in the region.
What is chlamydia and what are the symptoms of chlamydia? Chlamydia is a sexually transmitted infection caused by a bacterium called Chlamydia trachomatis. It affects both men and women, and is transmitted by having vaginal, anal or oral sex without protection with a person who has the infection. Most people who have chlamydia do not notice any symptoms and, therefore, do not know they have it. The research suggests that 50% of men and 70 to 80% of women do not have any symptoms with a chlamydial infection. How do you get chlamydia? Chlamydia is usually spread during sexual contact with someone who has the infection. It can happen even if nobody runs. The main ways in which people get chlamydia are by having vaginal and anal sex, but it can also be spread through oral sex. Symptoms of chlamydia. Many people do not notice the symptoms of chlamydia. Most people do not have any symptoms. If symptoms appear, they are usually 1 to 3 weeks after you have been infected. Some of the most common symptoms include burning sensation when urinating, yellow or green discharge from the penis or vagina, pain in the lower abdomen, pain in the testicles and painful sexual intercourse in women. Diagnosing chlamydia. Chlamydia tests are done with a urine test for men, or a woman is tested for urine or a swab taken from the cervix or vagina. You do not always have to undergo a physical examination by a doctor. Treating chlamydia. Chlamydia is treated with antibiotics. If left untreated, the infection can sometimes spread to other parts of your body and cause serious long-term health problems, such as pelvic inflammatory disease and infertility. Complications of chlamydia in women. 1. Pelvic inflammatory disease. Infection of the uterus, ovaries, and fallopian tubes that causes pelvic pain and fever. 2. Cervicitis. Inflammation of the lower part of the uterus. 3. Salpingitis. Inflammation of the fallopian tubes, preventing an egg from traveling from the ovary to the uterus. 4. Bartholinitis. Swelling of Bartholin's glands. Chlamydia can cause the glands that produce a woman's lubricating mucus to become blocked and infected, resulting in a cyst that can become infected and become an abscess. Complications of chlamydia in men. 1. Epididymitis. Infection of the tubes that carry the sperm to the testicles, which can cause fever, scrotal pain and swelling. 2. Urethritis. Inflammation of the urethra, the tube that carries urine from your bladder out of your body when you urinate. 3. Prostatitis. Infection of the prostate gland, which can cause pain during or after intercourse, fever and chills, painful urination and pain in the lower back. 4. Infertility. In rare cases, chlamydia can prevent a man from having children.
Conclusion. Men and women can both get the infection, but women are more likely to be diagnosed statistically. You are more likely to get an STI if you have sex with more than one person. The Centers for Disease Control and Prevention recommends that all sexuality activity women aged to 25 years and younger get screened for chlamydia every year, as well as older women with risk factors like multiple or new partners.